Thank you for your kind invitation. I am Roberto Teggi. I work in San Raffaele Scientific Institute in Milano. I am an ENT specialist, and my presentation will deal with the phenotypes of vestibular migraine. Above all, on vestibular migraine, we know that the presentation has been defined chameleontic. The duration of attacks may vary from minutes to days. Also, symptoms may vary. It has a lifetime prevalence of 1–2% of the total population, and diagnosis mainly rely on clinical history. A bedside examination is negative in 70% of these patients. As well as diagnosis of migraine mainly rely on the features of a headache. The headache must last more than 4 hours and have at least two of the followings: pulsatile headache worsened by effort, unilateral with photo and phonophobia associated. Recently, the Barani Society and the International Headache Society established diagnostic criteria for definite vestibular migraine, including at least 5 episodes with vestibular symptoms of moderate or severe intensity lasting from 5 minutes to 72 hours. That is to say, vestibular symptoms, not vertigo, not necessarily vertigo. They must have current or previous history of migraine according to the International Headache Society, and in 50% of vestibular episodes the patient must experience headache with migrainous features, photophonophobia and visual aura. Finally, other causal factor for episodic vertigo must be ruled out. It was also defined a probable vestibular migraine, which is not recognized by the International Headache Society, for whose diagnosis only one of the previous BC criteria must be observed. In the same paper, symptoms of vestibular migraine have been summarized in internal vertigo, the false sensation of self-motion in the surrounding; external vertigo, the false sensation that the visual surrounding is spinning or flowing; dizziness, characterized by the sensation of disturbed spatial orientation. It may be triggered by position, for example, while lying on the bed or getting up from the bed, from places with rich visual surroundings, visually induced vertigo, or head motion. Other symptoms have been also considered, for example, auditory symptoms, nausea, vomiting, but since they are not associated only with vestibular disorders, vestibular migraine, but also with other vestibular disorders, they are not included in the diagnostic criteria of vestibular. As for duration, 30% of patients have episodes lasting minutes, 30% hours, 30% attacks lasting several days. The remaining 10% have attacks lasting only seconds. They are normally clustered in specific days and may be provoked by head motion, visual stimulation, or changes of a head position. Some years ago, we began a prospective multicentric study, VM phenotypes, and the project aimed to collect data on phenotypes, accompanying symptoms, familial history, and the history of pediatric precursor of patients with vestibular migraine. We published at present data on 252 patients whose mean age at inclusion was 45 years old. In our sample, the first migraine happened in 22.9, the first vertigo 37.5. that is to say 15 years after the onset of the headache. In 16 cases, we had a synchronous occurrence of headache and vertigo, and they were characterized by a lower age of onset of both disorders. As for symptoms, patients may give multiple answers. Internal vertigo was reported by 73% of patients, having the sensation of spinning in 53.6% of cases. Dizziness was reported in 47.2%, external vertigo 25% of patients, postural symptoms 61.5% of patients. It was triggered by position in 24% of patients, triggered by head motion in 33.3%, and triggered by rich visual surrounding in 19.7%. Vertigo lasted 5 minutes in 23% of patients, up to 1 hour and 21%, 4 hours 11%, up to 1 day 17%, up to 3 days 5%, more rare more than 3 days. Other patients referred attack lasting minutes and hour, minutes and 1 day, minutes and days. As for accompanying symptoms, patients had two possibilities. Sometimes, that is to say less than 50% of attacks, mostly more than 50% of attacks. As for vision related, photophobia was obviously the most represented. Over near 90% of patients had photophobia during the attack of vertigo vestibular symptoms. As for hearing related symptoms, phonophobia, obviously, it was the most represented, but tinnitus was reported by 40% of patients as sometimes, and 10% in most attacks. Fullness of the ear, 30% sometimes, 9% mostly. Hearing loss, 15% sometimes, 2% in most attacks of data are not so different from those of another work in which I had a side participation some years ago, in which we reported tinnitus in 46% of patients with definite vestibular migraine, hearing loss in 25%, and in fullness of the ear in 34% of these patients. Vegetative symptoms, obviously, nausea and vomiting, the most represented, palpitation and choking, which in my opinion are more correlated with emotional disorders of these patients. As for familial cases, 73% reported migraine in the two generations before them, 66.2 episodic vertigo, and when asked the diagnosis of these patients, vestibular migraine was reported in 21.4, but Meniere's disease in 7.1 and BPPV 8.7. Precursors, motion sickness, 43% of patients had motion sickness in pediatric age, cyclic vomiting 9%, episodic abdominal pain 7%, and 5% episodic vertigo, the BPV, benign paroxysmal vertigo of childhood, and 12, that is to say 5% torticollis. A regression model gave us the idea that both BPV torticollis and motion sickness were predictive of a lower age of onset of the first vertigo, BPV 8.5 years, and motion sickness around 4 years lower age of onset. So among 24 subjects referring cyclic vomiting in pediatric age, 22 also referred vomiting during vertigo. Motion sickness in pediatric age was predictive for external vertigo. The age of onset of a headache correlated with the age of onset of the vertigo. So the last comments, the onset of migraine preceded the onset of vertigo of around 15 years, but patients reporting a synchronous presentation were characterized by lower age of onset of both symptoms. Patients with definite vestibular migraine may experience the auditory symptoms, tinnitus, fullness, and hearing loss during vertigo attack, which are more commonly reported in subjects with Meniere disease. Thank you for your attention.